organizations to require it. So we have the authority to require all organizations to require vaccination, and we think that's an entirely different thing. Circumstances vary across different, not just categories of healthcare worker, but different parts of the state, different employers, those kinds of things. And I think one of the things we're concerned about is doing something sort of in an across-the-board mandate, whether a particular business feels like it needs it or not, and having a big impact on the healthcare workforce, which is very fragile right now. People have been working really hard across the healthcare systems for going on a year and a half now, and we've got challenges being able to keep all kinds of facilities functioning the way they need to based on staffing. And so at this time, we would be reluctant to mandate all healthcare providers or entire categories of healthcare providers require vaccines for that reason.
I wanted to ask something that's never discussed. I'll back up just a little bit, and that is that the messaging coming from OHA with the Delta variant is very similar to what we heard earlier about the Alpha variant. And I'm just thinking that people who, are skeptics, and kind of poo-poo the whole pandemic, I'm just wondering if using the same kind of messaging, well, here comes the Delta variant, it's really more serious, you need to get vaccinated, why that messaging, and sort of follow on to what Gary asked, why this messaging would work, and combined with that, I'm wondering why, nothing's said about long COVID, which is a very scary thing. I mean, that's what I'm scared of, not dying, but getting COVID, long COVID, and then you're sick for the rest of your life. So if you could address that, it would be great. Thank you.
Sure, let me take a crack at it and maybe invite Dr. Seidlinger to add on as well. I think throughout the pandemic, I think at the Health Authority, we've tried to have our messaging be, here's what we know about the facts, here's what we don't know, here's what we believe is going to happen, here's what we think the consequences of that will be, and try to have our, quote-unquote messaging be what we think the facts are and how we interpret those facts and what we think people ought to do based on those facts. And I think that's a pretty reliable way for a public agency to try to message. I think you raise a really interesting point about long COVID. We have tended to talk more about, short COVID, because it's so much more common, and the effects are hospitalization and potentially death. What I don't know, and perhaps Dr. Seidlinger does, is sort of what's the extent of long COVID, and perhaps more discussion of that might be helpful. I think it's a good point. Dean?
Thank you. I think, as we continue to learn more about COVID in general, the disease known as long COVID or post-acute COVID-19 syndrome is an area that we know even less about. I think we're learning more as our academic partners and healthcare partners are treating patients and following them over time to see what the long-term sequelae are and what's the actual percentage of people who have these types of symptoms that afflict them and for how long. There's been some data that's looked at, a subset of 50% of some hospitalized patients may still have symptoms in the weeks following their discharge, but we don't yet know the full extent of that. But what we do know is that if we can prevent COVID-19 infection, we can prevent the long-term sequelae as well. And the vaccines we have seem to be very effective at preventing, or are very effective at preventing COVID-19. There's some initial data that shows that they may also be effective at preventing or improving long-term COVID symptoms in those who have them. But we don't have those definitive answers. So we, wait for studies that are coming from our academic and health partners in conjunction with public health to see what are these long-term effects, how many people are they impacting, and how long do they last.
And I'm also reminded that we have featured one or more long COVID patients at press conferences previously, but Lynn, to your point, it's not been a regular part of our messaging.
Thank you, Lynn. Okay, our next question is from Fedor Zarkin with the Oregonian. Go ahead, Fedor.
Hello. So vaccinations, like growth in vaccinations, is essentially plateauing. We're not seeing a substantial rise at this point. So is there anything really that OHA can do or is considering doing that would change that trend? Like at this point, are there other tools that you guys have? And if not, how realistic is it that Oregon will ever reach an 80% vaccination rate?
Well, I think that I would not. Maybe we're using plateauing differently. I don't know that I would agree that we're plateauing. I think certainly the rate of increase is slowing, but we're getting 2,000 first doses a day right now, and I would point to growth rates of vaccines amongst seniors. Every single week, we're adding 1/10 or 0.2% to seniors who've been highly vaccinated for a long period of time. So I do think it's realistic for us to get to an 80% level. I think it's going to take some time. There are ways that dynamics will change. Anecdotally, I've seen stories that in other parts of the country where Delta variants have taken off even more significantly than they have here, that has caused a corresponding increase in interest of the vaccine, particularly in areas that are suffering now a lot of COVID infections, and they really, I think, maybe more directly see the impacts of what not being vaccinated does. I think there have been some reports of some changes in some media circles, in some houses of worship communities, those kinds of things, where some of the messaging to encourage vaccinations is changing, and I think that could have an impact as well. So I think is there some kind of a tool in the toolbox that we've been holding out on and not using that we think will have a big impact on increasing vaccinations? No, there's not. But I think circumstances in the community can change, and I think that's why we continue to try to make as much information about vaccination and the impacts of non-vaccination as widely available as we can.
I think just to add on that, we're not going to see vaccines increase the same way we did at the beginning of the pandemic. It would be hard for us to hold a mass vaccination event right now and see, 5,000, 6,000 people show up and get vaccinated. The vaccination efforts take more time, often take more outreach and education from trusted folks in the community. So making those linkages, making sure the vaccine is available in a convenient location is very important. But we have additional tools, such as what Director Allen mentioned, with kind of doing some canvassing in neighborhoods with lower vaccination rates, communities with lower vaccination rates, to try and make sure we can get to people where they live, where they spend the most time, and get them the information and get them linked up to a vaccination effort in their community. So these vaccination efforts are slower than some of those early mass vaccination efforts, but we continue, as Director Allen said, to see a couple thousand people initiate their vaccination series every day. We hope to see that uptick some, but we won't likely see dramatic increases in that.
If I could ask just a follow-up. So do you plan to recommend that employers mandate employee vaccinations as a condition of work? Why or why not?
Well, right now,
I think what we've done. Go ahead, Pat.
I was saying, right now, all employers other than healthcare employers can already do that. And so I don't think we have plans at this. I would say we don't have plans at this time to require employers to do something that they're already able to do. And we've already talked about the healthcare lockout circumstance, and I don't think I have anything to add there.
Well, will you recommend or urge that employers do so, that they mandate that their employees get vaccinated?
Well, I think maybe a step short of that. I think we strongly encourage employers to facilitate their employees getting vaccinated, to hold employment worksite-based vaccination clinics, to provide time off for side effects, those kinds of things. And many employers have done that, and it's certainly an effective tool. We don't have plans at this time to require them to mandate vaccines.
Oh, I'm really sorry to just follow up, but why are you stopping short of recommending that they mandate? Recommending as in they have the choice, but you tell employers, hey, we think you guys should mandate that your workers get vaccinated.
If I'm following what you're saying, I think that the challenge we have is we have high vaccination rates already in places where populations are well disposed to get vaccines. We think in places where the population, where vaccination rates are low, that persuasion and information from trusted sources is likely to be a much more effective way to get people vaccinated than someone saying, I don't care what you think, you have to get vaccinated. I talked earlier about, some media outlets changing their position on vaccinations, some faith communities changing their positions. I think those kinds of channels, I think conversations with healthcare providers are all likely to be much more effective in persuading people to get vaccinated. And I think, again, back to the example of what's happening in other parts of the country with Delta, seeing much more right out in front and visible the impacts of not being vaccinated and how they differ from places that are vaccinated is more helpful. I'm very concerned that simply a direct order right now, given the highly political nature of COVID itself and the vaccines particularly, I think is not likely to be a highly productive tool.
Thank you.
Thank you, Fedor. Our next question comes from Amelia Templeton with OPB. Go ahead, Amelia.
Yeah, I'm wondering if there are any state Republican leaders who are helping you champion vaccinations, county commissioners, state legislators, mayors, anyone else who has been doing outreach to their fellow partisans, given how politicized the issue is.
I've had a number of conversations with various county commissioners, other local leaders. It would be better to let them speak for themselves in terms of how they're advocating in their communities. But I think across the board, there are political leaders who are interested in what they can do to help provide good information to their constituents about the value of getting vaccinated.
Have they told you that they don't wish to be publicly named as vaccine champions, or that it's not helpful to have OHA publicly commending them for their work?
I would not say that I've had exactly that kind of a conversation with that language. I think I've had lots of candid conversations about in various communities who are the right messengers and what's the right message. And I would go back to, I've said a couple of times, healthcare providers and houses of worship and friends and family really are much more effective messengers in a lot of places than government agencies or politicians or movie stars or athletes for that matter.
Last question, different subject here. Are you tracking how close counties are to herd immunity, not just the vaccination rates county by county, but your estimate of how many people have been infected? It seems like with the Delta variant and just how transmissible it is and how quickly it spreads, that I guess I'm wondering if some counties are going to tip over into herd immunity through natural infection and vaccination combined.
I will say, I think, we've been done a good job as a state of having fairly low COVID-19 infections throughout this pandemic. And certainly there have been parts of the state that have had higher numbers of infections, higher case rates during the surges that we have and are being more impacted now by this increasing cases from Delta. And certainly we know that at least for the short time that those individuals likely are protected from COVID. We don't know how well natural immunity will protect them from variants that they weren't infected with. We have more data on that from vaccinations, and getting vaccinated comes without the potential for hospitalization and death that infection comes with. So certainly I think as we see increased cases in some of these counties, that will help contribute to slowing the spread, but it comes though at a huge cost. And even those individuals and studies have been shown that as someone who's recovered from COVID, when they get a vaccine with COVID, their immune response is very strong, indicating that that vaccine offers them some additional protection that just having recovered from COVID doesn't offer.
The only thing I would add to that is I think we are challenged by the fact that we have never been able to identify 100% of every case, and so our base for our database for what's the percentage of populations in each county that have been exposed is significantly incomplete. It's hard to pin down even at the statewide level, but harder at the local county level to know what an exposure rate in a given county is.
Thank you so much, everyone. It's 3:08, and we are going to wrap things up. I see there were a couple additional questions added into the chat. We'll get back to you, Lynn and Gary, with answers to those follow-ups. And as always, to our media partners, remember, we've got that Oregon COVID-19 media email, orcovid19.media@dhsoha.state.or.us. So send any follow-up questions that perhaps we didn't get to today our way, and we will do our best to answer them. I want to thank Director Allen and Dr. Seidlinger and all of you for tuning in today. All of this will be available in the daily media release released here.
Okay, thank you for listening. I'm not going to listen to the beginning of this right now that we missed.
Recently contracted COVID-19 and unfortunately passed away. It's past. It's something to
All of you for tuning in today. All of this will be available in the daily media release.